Good morning and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing well this morning. My name is Katie Berg and I'm a research study coordinator here with the Havey Institute. I'll be leading today's discussion. As always, I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Good morning. Nice warm day.
Very, very warm. And our returning viewers will remember Dr. Murphy as the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey IGH Facebook page. Today, Dr. Murphy will be reacting to the latest COVID headlines, public health headlines as well, through today, August 24th. We invite you to submit questions as always below in the description, or you can see our Facebook link, NU Institute for Global Health, and email globalhealthinstitute@northwestern.edu. Starting out today, we have some COVID statistics for the US. Average cases per day, somewhere around 10,000, maybe higher, maybe lower. Average new hospitalizations per day is a concrete number, 1,801 per day. Average COVID deaths per day, 36. And new booster proportion staying steady at 17%. While I ask Dr. Murphy for your reaction to these numbers, I'd also like to ask about this new variant that in the past 24 hours we've been hearing about. Is this more EG5 or is this something else?
Okay, first with the statistics. The hospitalization and the death rate are pretty firm numbers. And for the fifth or sixth week in a row, we've had an increase in hospitalizations. I don't know if you remember, it was down around 1,000 and now it's 1,801. That's a 21% increase. This is going in the wrong direction. The death rate is still very low, 36. But remember, that first you get the infection, then you get sick, then you end up in the hospital, you survive or you don't survive. So the death rate is the last number to change and the last number to get better. So we were down around 25 cases per day, and now we're up to 36. So 36 cases per day. So, you know, it's still, these are relatively small numbers compared to what had been going on in the past, but why is this happening? It's happening because people think COVID is over. A lot of people are not boosted. Look, I mean, only 17% have taken the bivalent vaccine. Kids aren't getting vaccinated. Hardly anybody's wearing a mask anymore. Hardly anybody's getting tested anymore. The government's not supplying free tests. I mean, on and on and on. It's just a setup. COVID is not going away. And as you mentioned, there's a new variant that has been reported in the last 48 hours called BA.286. And this is not EG5. We've been talking about EG5 last week and the week before, taking over. Within a month, it became the most common variant. And that's it's still in the Omicron family. This came from Omicron, but it has changed. The virus has changed substantially. BA.286, it has 36 different genetic mutations from the XBB 1.5. That was the last big Omicron one that came out. So this is really a variant of interest because it is not suppressed by the current neutralizing antibodies that people have formed from having prior infections or vaccines. There's only 2 cases reported in the US. The first was at the University of Michigan in Ann Arbor. 3 cases reported in Denmark, 1 in Israel, 1 in the United Kingdom, and 1 in South Africa so far. So there's like about 8 of these things out there. But now everybody's sequencing like crazy to see if this thing is going to take over. So what does this mean? Well, a lot of people are afraid because it's changed so much that all the prior immunity that you had from vaccines and infection may not be so good anymore, and that we're going to have this big spike again. This is what happened with Delta. This is what happened with Omicron. What is it going to be with this? We don't know yet. Now, I look back in our records to 2021. I don't know if you remember when Lambda came out. So Lambda was a virus that was first identified in Peru, spread to over 30 countries. And the same thing was said, oh, there's 7 genetic mutations, it spreads faster. We don't know if it's worse or better or whatever. And it's in all these places, is it going to take over? No, it pooped out. It just got overrun by the other variants of the day. So we don't know what's going to happen with this, but we've got to really be careful. But this is going to be a never-ending story. Now, the current vaccine that's coming out at the end of September, the new Pfizer, Moderna, and Novavax vaccine, which is geared towards EG5 and its relatives, the Omicron family. We don't know how well that's going to work against this, and that most likely we'll have to see what happens. If this thing really takes off, we'll have to have another new vaccine that's geared towards this. But for right now, everyone's just keeping an eye on it. The other weird thing about this is that, as I mentioned, the countries, and this has all been identified just recently. I mean, the US, Denmark, Israel, UK, South Africa, we're talking many continents involved. How did this thing all of a sudden show up in Africa, North America, Europe, and in the Mideast? It just bewildering how that happened. And some of the people that have been studied had not been traveling or anything like that. So it's probably already in the communities, and we will understand more once we start sequencing everybody again. So it just tells you how important it is to keep an eye on this stuff. And, if we have to, we'll change the vaccine again. So we'll see. We really don't know any more than that. This is being reported literally by the hour.
Absolutely. So we will definitely keep you guys informed about this. We are, keeping up as we can. There's just so little out there right now because it is so new. But something that we do have a lot of information on, that we have been hearing about a lot the past few weeks and months, is different approvals for RSV vaccines and treatments. The FDA recently approved Pfizer's vaccine for different purposes than it was previously approved for. Can you tell us a little bit about that, and just break down what RSV treatments are available at this point?
Yeah, so RSV, there's no real treatment for adults anyway. There's a treatment in kids to prevent it, a monoclonal antibody. We'll talk about that too. But RSV causes about 10,000 deaths per year, and mostly in adults and in a few hundred children. So it's something to be concerned about. The risk is predominantly in older adults. So the current vaccine that just got approved is in adults 60 and over. And then it's also common in people with underlying cancers or people who just had an organ transplant and the like. So very immunocompromised or 60 and over. That's what it was approved for. So this new approval is for pregnant women, specifically for pregnant women. And why is that? Kids under 8 months are the ones most at risk for RSV, and they're the ones that clogged up the whole intensive care system in the pediatric world last season. So to protect those kids, you vaccinate the mother while she's pregnant. The mother makes the antibodies are passed to the child, and the child gets protected. And they did a big study and showed that that was exactly what happened. Otherwise, kids under 8 months can take this treatment. It's a monoclonal antibody. It's just one injection. I think it's an injection, but one treatment, and that will protect them. That's also been shown in a clinical trial, and it's also approved for kids up to 19 months if they're vulnerable, if they have some underlying medical condition that puts them at risk for RSV, because it can be so deadly and make kids so sick. So these clinical trials have involved thousands of patients, and are over 80% effective.
That's really, really great news. And also, it's very interesting that there are, within the same company, several different angles at protection for people at different points in their lives. So that's really great that
Yeah.
There's all this coming
Well,
together.
to illustrate further how tough it is for kids, some up to 80,000 kids under 5 years of age are hospitalized every year due to RSV infection. That's a lot of hospitalizations in the pediatric world. So if this can, these approaches can really make a dent on what's going on with RSV, which is it's deadly.
Absolutely. And another study that recently came out was on long COVID and how some symptoms can linger for a very long time. Can you break that down for us?
Yeah, this was a very interesting study from the Veterans Administration. Now, the Veterans Administration has had a computerized medical record for many, many years, and it's unified throughout the United States. So they have a very rich database, and they looked at 139,000 veterans who came in who were diagnosed with COVID in 2020 and compared them to a group of 6 million veterans who were not known to ever be infected. Both sample groups were tracked every 6 months for 2 years, and they reported their results. And what they found, looking at, I think, 82 different problems that could happen. Now, the veterans typically tend to be older men, but there's a mixture of women and younger people as well. But I mean, it is not the general population. It is a different kind of population, perhaps a riskier population because of the age factor. But they found that 31% still had some kind of symptom that could be related to long COVID. Now, they're not necessarily disabled from it, but they still had a symptom. So that is really quite dramatic. And you're going to see more and more of these type of data come out. There's that other really large, more general population study called Recover, and that's run by the NIH. And we're going to be hearing more and more from these studies as we go out further, because now we'll have more data for a longer period of time.
Absolutely. And I think it's really important to highlight what you said about this not being as general of a population. And that's why we see maybe different percentages or different numbers of people who are having these
Right.
persistent
I mean,
symptoms.
there's
Excuse
an
me.
explanation for that. That doesn't mean you throw the data out, but you just have to take it into some kind of context. But it also tells
Absolutely.
how important it is to stay up to date with your vaccines, because it's clear from all these studies that the people who were vaccinated and the people who took Paxlovid and other antiviral agents do better with the disease and have less long COVID. So, who wants to have some kind of symptom? 31% of people still with a symptom 2 years later? Oh, this is terrible. So it's just another reason to stay on top of your vaccination schedule.
Absolutely. And a bit of a shift here now. There has been some recent news about locally acquired malaria cases. We've talked about them in Texas and Florida, but I saw that there's another state that has now announced they have a locally acquired case. Can you tell us a little bit about it?
Yeah, so there have been 8 cases that did not involve travel. So there's some 2,000 cases of malaria per year in the United States. It's mostly people who went someplace, got malaria, and came back and got diagnosed here. Like myself, I was working in sub-Saharan Africa for a long time. I came back, I had it twice. And that's a typical case, and you know how to treat it, and you just treat it. These 8 cases, these people didn't travel anywhere. So, how'd they get it? And then the last case was in Maryland. I mean, it's not like, the deep South, where malaria used to be a big problem. But with mosquito control and everything, it went away. But 8 cases is a lot. We haven't had that many de novo cases since 2003. And I remember when I was a junior faculty here, there was a case of a kid from New Jersey who had malaria, local malaria, a kid who never traveled anywhere. So it can happen, and that's because these mosquitoes are everywhere, and there's just more and more of them, and they're biting people who are infected and then going spreading it to people that never traveled.
Mm-hmm. Absolutely. And our last story for the day, which we've touched on a little bit, but Moderna, Pfizer, and Novavax have all been coming out with very strong statements about their new vaccines and how they'll react to the newest variants we're seeing. Can you let us know a little bit about what they're saying, as
Well,
their data has not been publicly released yet? Thank you.
right. So these vaccines are ready to go out the door. They're 1 month from now, they're going to be out the door, and literally everybody should go out and get this because they're effective against EG5 and all the Omicron variants that are floating around right now. We don't know about BA2.86. We'll find out about that. But, we'll see how that grows and if the vaccine is protects against that. We don't, that's an unanswerable question. But the bulk of 99.999% of the cases right now are these Omicron variants, and this vaccine works very well against those. So we need to get the whole pool protected against what is predominantly circulating right now in the world.
Absolutely. It goes back to herd immunity, which we talked so much about before the vaccines were readily available. And now that they are, please, please, please go out there and keep
Yeah.
yourself safe.
Well, but this is very similar to the flu. Every year you get a new flu vaccine. Every year or every 6 months, you may have to get a new COVID vaccine. It just depends how it mutates and how deadly it is. Remember, things were sort of getting better, and then all of a sudden we had Delta. Remember Delta? Delta was a more serious disease. Then Delta got beat out by Omicron. Omicron was more easily transmitted, but it was a milder disease. Now we don't know about this BA2.86. We'll see if it poops out like Lambda or it becomes like Delta. We don't know, but we have to watch. And this will not be the last one. Let's put it that way. So we have to just be vigilant. We have to learn how to live with this virus because it is not just going to go away.
Absolutely. And that's a great point to say thank you, Dr. Murphy, for your expertise and for continuing to keep us updated on everything COVID and public health and infectious disease. So thank you for your time, and we very much appreciate it.
And enjoy this, I think, last really hot day of summer.
Oh, yeah. If you're in the Chicago area, you know that it is very hot today. Please stay cool, enjoy the weather, but stay hydrated.